Preeclampsia. Preeclampsia is a multi-system disorder that complicates 4.6% of pregnancies worldwide. Preeclampsia is considered gestational hypertension that is onset after the first 20 weeks of pregnancy. If hypertension is onset before 20 weeks of pregnancy, it is considered chronic or pre-existing hypertension. Preeclampsia is caused by abnormal remodeling of the spiral arteries of the placenta. The risk factors include a first pregnancy, history of hypertension, diabetes, obesity, autoimmune disease, age extremes, multiple gestation, and genetic factors. The symptoms include severe hypertension, proteinuria, edema, persistent and/or severe headache, visual abnormalities, upper abdominal pain, nausea, vomiting, altered mental status, impaired liver function, shortness of breath caused by fluid in the lungs. So how does this happen? In a normal pregnancy, you can see the widening that helps with perfusion, an increase of blood flow to the placenta. In the preeclampsia spiral arteries, you can see that they do not widen enough to increase blood flow. The brain perceives this as hypoperfusion, or bleeding out. So the brain releases vasoconstrictor hormones and redirects the blood to the vital organs. The baby is not perceived as a vital organ. The vasoconstriction increases blood pressure and starts to cause wear and tear on the endothelial cells. This endothelial dysfunction causes microscopic holes in the vessels. The endothelial dysfunction causes the brain to stimulate a lipoprotein called fibronectin. The fibronectin then starts leaking into the interstitial space. Water follows protein, so naturally the water in the vessels follow the fibronectin, leaving the cells and starting to collect outside, which is causing the edema. With fibronectin leakage occurring throughout the body, the fibronectin leaks into the kidney and into the loop of Henle, then to be excreted in the urine. The liver is also experiencing vasoconstriction, which can lead to ischemia of the liver. Because the hypoperfusion is perceived as bleeding out, the brain will activate the coagulation system, sending out clotting factors. These can start to build up in the arteries. If a preeclamptic woman develops seizures, she is now considered to have eclampsia. This may include a stroke, dialysis, and mechanical ventilation. Since the placenta is the cause of the vascular damage, the only complete resolution is delivery of the placenta.